Good morning, Dr. Garima here, and we'll be solving another Australian Dental Council practice paper question. And this question is very, very important, as in this topic is very, very important. To all the new candidates, you can watch my other videos to understand how I guide and advise on solving questions because they are tricky and you have limited time. And to those who have already watched my several videos, well, this is another of it, and let's straight away dive right into it. So, this topic is about bisphosphonates and related complications like medically induced osteonecrosis of the bone and bisphosphonate induced. So there is a proper classification of it which is provided in therapeutic guidelines. Please read that. Definitely around 2 to 3 questions will be asked on this topic, as a lot of elderly population in Australia, even worldwide, but since you're giving the ADC exam, in Australia take bisphosphonates. Now you have to understand what are bisphosphonates first of all, and why are they important to you as a dentist. See, bisphosphonates basically reduce the chance of osteoporosis. So what they do is they inhibit the action of osteoclast. Osteoclast eat away the bone, basically help in remodeling it. But already when the patient is at a risk of osteoporosis, you do not want osteoclastic activity. Now, though it's beneficial otherwise, but what happens in the jawbone, especially when you are doing an extraction procedure, the wound that is created because of extraction needs to heal. Now, that healing needs to have a bit of osteoclastic activity, as a remodeling of the bone is required in that area. But if a patient is in an active phase of bisphosphonate therapy, then that action gets inhibited. Now, it is not like all 100% of people who are taking bisphosphonates, in every one of them there would be a risk of necrosis. There is a very minute risk, but it is there. So if you are aware that a patient is taking bisphosphonates, then you have to time your dental procedure in a way that you mitigate that risk. You minimize the possibility of that risk, trying to prevent it. Okay. So that is why this knowledge as to when the patient is taking bisphosphonates is very important. Now, you as a dental practitioner cannot modify the dose or ask the patient to stop it if you want to do a dental treatment, because his overall health is more important. Dental is a part of it, okay? But you can always liaise or work in coordination with the medical practitioner of the patient and time your extractions, or time the therapy of bisphosphonates in a way that your dental treatment gets done and the patient does not suffer while he's undergoing the active phase of the treatment. Now, having understood this point and this theory, I want you all to remember certain names of drugs which are commonly used. You can just Google IV bisphosphonates and oral bisphosphonates and write the brand names of the drug, the contents of it, and just remember them, because sometimes in the exam, in part 1 and part 2 both, they'll just give you the brand name and you are expected to know what it is. Okay, so let's start solving this question. It's a little bit of tricky question, I have to say. So if you have the concept thoroughly etched in your mind, then it's easy to solve. Otherwise you will struggle. So my suggestion is pause this video, brush up a bit on bisphosphonates from therapeutic guidelines, and then come back and then let's solve together. Okay. So Mr. Edgar, a 74-year-old male patient who has been referred by the local hospital for a dental checkup. Before his first infusion of zoledronic acid, they have been kind enough to give you in the bracket a bisphosphonate at the hospital in 10 days. So in the next 10 days, he's going to have his first infusion of a bisphosphonate. Mr. Edgar shows you an information sheet he received from his doctor on intravenous bisphosphonates. So he is going to receive IV. Why this fact has been mentioned? IV bisphosphonates are more damaging, as in they cause more consequences of osteonecrosis than the oral form. So IV is basically a stronger medication, and you have the information sheet now stating that the patient is going to take an IV bisphosphonate, so you should be even more cautious. An OPG was taken for the initial assessment. Okay, now this is the OPG. Now what do you see in the OPG? You see multiple fillings, a root canal treatment is done on 2 of these teeth, and out here, this tooth 3-6, you can see a root canal has been done, but it's not as great as these 2 teeth. And you can also see some structural anomaly in the root. What is this? It's not like this. This is hypercementosis. Okay. You have to observe all these things on the OPG which is provided, because there might be questions related to this. So apart from this, all seems okay. There is a missing tooth. This tooth, I would say, is non-restorable or re-RCT, or maybe I see some fracture line kind of a thing, maybe needs an extraction. So if there's one tooth which would be bothering me with related to the bone healing, it would be this tooth. Okay, the others, I think you can give crowns and all, but that wouldn't cause a problem in the bone health. All right. So now let's go back to the first sub question. What is the priority goal in Mr. Edgar's treatment plan? Okay, now you got an OPG, you did your clinical examination. Priority goal, okay, that adjective priority is very important here, because the first thing that will heal the bone faster, that should be your treatment. Nothing else, like scaling, polishing, fillings, etc. won't cause much bone problem, but any extraction would cause, and he's due to receive his first dose of bisphosphonates. So what is the priority goal? Establish excellent oral hygiene habits. Oral hygiene habits is a goal, but not my priority goal. Prevent the development of new carious lesion. Prevention is again a goal, but not my priority goal. Restore missing teeth and stabilize the occlusion. Place crowns on root canal treated teeth. That I can do at any point of time because it does not involve the bone. Extract any non-restorable tooth. Yes, that's my priority, because once he starts with bisphosphonate therapy, my risk of having osteonecrosis after extraction increases. So my priority is to do any extraction before the patient starts any treatment, so that my healing happens faster. You understand? So my priority goal is E. The rest of A, B, C, D are goals, but they are not my priority goal. Okay. In consultation with his medical practitioner, Mr. Edgar's management plan needs to be altered. What is the most appropriate change? Okay. So now you are coordinating with his medical practitioner and you tell him, listen, I need to extract a tooth and I don't want the risk of osteonecrosis. So what you will tell him, please delay the first IV infusion of the medicine, right? So option A, to delay the zoledronic acid until the dental treatment is complete. That is what you're going to communicate. To prescribe oral rather than IV is not your call. That let the general practitioner decide. To prescribe prophylactic antibiotics before any dental treatment, not needed. To provide restorations only and start IV bisphosphonates, not correct. You cannot delay the extraction of a tooth if the patient has not had the first dose, because you saw tooth number 3-6. You saw how non-restorable it was. You saw it can give a problem, and once the patient starts an IV for the next 6 months, impossible to extract. And what if the patient has pain? Then why put him at a risk? So extracting the tooth before the treatment is the correct option, and if you want a little more time for the healing, then you will request the GP to delay the start of the first dose of the IV bisphosphonate. After the clinical examination, it was noted that the 3/6 has an unsatisfactory root feeling. You remember we spoke about this? And an apical infection, and was deemed unrestorable and charged for extraction now. Now, this line is very important in the question. What is the most significant local factor that could complicate the extraction of tooth 6? Very nice word they have given, local factor, okay? Local means what? Related to the tooth. Anything else is systemic factor. So, brittleness due to root canal treatment, you can consider it's a root canal treated tooth. Hypercementosis around the bulbous mesial root. That is more of a complication than brittleness. In brittleness, what will happen? It will break into pieces. But in hypercementosis, wow, you can lead to fracture of many things, the root. It's difficult to extract that broken root. It can fracture the bone. C, D, E options are not that important. If you are confused, you'll be confused between option A and B. And hypercementosis is any day more of a complication than just a brittle tooth. So you will choose option B for this. When obtaining informed consent for extraction of tooth 3/6, what is the most important action to be considered? Now, this is not related to this patient alone. For any of your patients in your clinical settings, whatever treatment you are doing, the most important thing when you're taking an informed consent is that you should make sure that the patient has understood what he's signing, be it any language. I get so many Chinese, Korean, Japanese patients. They barely know English, and I obviously do not know Chinese, Korean, and Japanese languages. So then how do I take consent for them? I Google translate everything. Everything comes. I write each and every word of what my big consent paper has. I copy paste it, and that entire thing comes as Google Translate. And then I ask them to read it. Only when they read and understood and give me a thumbs up, or they also Google Translate and say, yes, we have understood each and everything that you have mentioned, then only I proceed for the procedure. I do not give them a paper in English, the consent paper, and ask them to sign at the bottom. No, this is not how the consent works. You should make sure that the patient has understood what he's signing up for, okay? Don't be in a rush. Take 10 minutes, even though your procedure may require just 5 minutes, take 10 minutes for the patient to understand what you're about to do and what he's signing for. So the answer here is checking that the patient understands the information provided, not any other thing. Signing a written consent without the patient understanding is not your goal. Providing a pamphlet that explains the procedure in simple language, okay, but it doesn't mean that the entire information has been understood by the patient. Explaining the benefits and positive outcomes of the treatment, that forms a part of the consent. Ensuring that a witness is present while obtaining informed consent. That is an additional advantage, honestly, but not always a witness would be present. What if an adult patient comes alone? So, and you can take your own dental nurse as a witness, that you can, but it's not a mandatory requirement. But what is mandatory is that whoever is signing that informed consent, like what I mean is the patient, needs to understand. In my practice, it works different because I treat pediatric, but the parent needs to understand everything, okay? Even though the patient may not understand anything. They are busy watching cartoons, but the parent needs to understand everything. So if the parent was the patient, like if I have an adult patient, then obviously the adult patient needs to understand what I'm explaining. So, checking that the patient understands the information provided is the most important action. The rest of the things are also important, but the most important is option D. Now you are concerned about the risk of medication related osteonecrosis of the jaw. What is the safest time for performing the extraction to reduce the risk? Reduce the risk, not prevent it. There would still be a risk, okay? But you want to reduce the risk. So the best time is before the patient starts the treatment. Option A, anytime the risk is the same, regardless of the time frame, is wrong. As soon as possible before the administration of the IV injection next Friday, correct. Midway between two subsequent IV injections. This would be my next best option if option B was not available. Sometimes my candidates get confused. They're like, why not option C? Option C is not wrong, but if I have the option of B, I will prefer that. Because if I go for option C, it means that I'm going to wait for 6 months. The patient has already started IV, and then when there would be a break of a week, I will do extraction at that point of time. Why wait for this 6 months when the patient has not started with the IV bisphosphonate? Had the patient started IV bisphosphonate, and the question would have said, the patient has finished 1 month of IV bisphosphonate, he has a bad tooth, not in pain, wants to extract. What is the best time to extract? Then you would have said in between the 2 doses or before the commencement of the next dose. Then option C would have been correct. But when the question is saying that the patient has not started IV, then it's better you extract it before, right? So that's why option B is better than option C. 2 weeks after temporarily ceasing the IV injections. Oh no, you are not going to cease anything. Like I said, the overall health is more important. Dental is a part of it, not the entire thing. So I hope you have understood how to solve a bisphosphonate related question. Take this topic seriously, okay? Like, it's gonna be asked. There has never been a question paper of ADC where this question has not been asked. And mostly it would be the same question. Just name and the age would be differing. But 99% it would be based exactly like this, you know. If you have taken my course and you're solving the mocks are basically the past ADC papers that I have provided. You will see similar questions with just the change of name of the patient and the age, but the questions are the same. So it's a simple topic if you understand the concept of it. Otherwise, you're going to make a mistake. Now, I'm just sharing the 2 other books that people keep on asking me from where to study, what to study. Buy this book. This will have scenario-based questions from Odell, very important book for ADC exam, therapeutic guidelines, that's the gold standard, infection control, ethics, consent, I wrote the spelling wrong here, consent, COVID-19 and public health dentistry. There are 440 scenario-based questions. I'll just give you a glimpse of it. The questions are like these: question, answer, explanation. So see, because therapeutic guidelines is a booklet, you know, it's an information booklet. Once you read, you know the information, but when it actually comes to solving questions asked from it, you sometimes wonder what is the answer. So this is your practice question bank of therapeutic guidelines, and these are the things. And the second book is the Ultimate ADC Written Companion book. Now this has questions from these many textbooks, and these textbooks are given by ADC on their website and ADC resource. I'm sure when you were studying your dentistry, becoming a graduate, some of the books you have read, but not all of them. And these are the books from which the ADC prefers asking questions and takes the answers from them. So I have sat, read and prepared scenario-based questions on these. Again, I'll show you a sample, you know. So question, option, answer, explanation. It has over 1,400 questions, you know, like I know how many months I took just to prepare this, but I have got a lot of amazing feedbacks from my candidates that they're very thankful for this book, because this is like a question bank. So this book plus the comprehensive book plus the mocks, these 3 things you do, you practice at least 5 times, you should be confident in clearing your exam then. So I'm happy to share the sample copy of these 2 books and a sample mock test to you to understand how the ADC question paper is like. You can email me. I'm writing the email in the description of this video, and I'm happy to share back these things to you. So have a nice day. Also, I keep updating a lot of questions on my Target ADC Facebook group. You can join that. You'll get a lot of updates of what is going on in the ADC and free questions to solve. Like, I keep taking questions from these books and putting it 1 question a day for you to be updated, and it keeps you in check how much you know. So have a nice day, and always happy to receive your comments on my channel. Take care. Bye bye.